Well, I'm a graduate at Monash University, and I graduated in 1977. Did a few hospital jobs, spent a couple of years at Prince Henry's, did my obstetrics at the Mercy, and then did a year as a medical registrar, and then 6 months paediatrics at Queen Victoria Hospital. So I've got a record of hospitals, working in hospitals, and then they closed down. But I then went to the Royal Melbourne and worked in medical administration there. And my wife Yvonne wanted to do some obstetrics, and she came up to Horsham to do 6 months of obstetrics with Eric Miller. And I still don't know to this day, but I managed to talk my boss from medical administration into sending me to Horsham for 6 months, so that we weren't separated. And 6 people came from Horsham for a month each and worked at the Royal Melbourne. Don't know that the Royal Melbourne got the best part of that deal, but anyway, it got me 6 months up here. And the then medical director, Max Griffith, who was a very eminent anaesthetist, I think he was born in Warwicknabeal, and he came back here for the latter part of his career. And he told me when I came up here that he was retiring, and was I interested in the position. And I was here for 6 months, and I really enjoyed myself. It was a very different atmosphere to the Royal Melbourne Hospital. And you could read something in a journal or come up with an idea in the morning, and you could implement it in the afternoon. And when I went back to the Royal Melbourne, Yvonne still had 6 months to go, and so did I. And I remember talking to my boss at the Royal Melbourne, and it was at the time that Australia won the America's Cup with Australia too. And I said to my boss, look, it was really nice. We were able to implement a whole lot of things there. And he said to me, well, changing direction at Wimmera Base was like changing direction on Australia too. But changing direction at the Royal Melbourne was like changing direction on the Titanic. And I said, well, I wonder whether it was probably the sunk Titanic. It was that hard to change direction there. And the job came up here. I applied for it. I don't think they were inundated with applicants, and I got the position. And I started in 1984, in January 1984, and I finished my career here due to illness in 2020. And I've thoroughly enjoyed my time here, been part of a lot of innovative things. Very, very good culture and collegiality and collaboration here, and we've done some really exciting things. The hospital's developed enormously. When I first came here, there were 5 junior resident staff. There were 3 interns and 2 registrars. I think these days we've got something like about 26 of them. They're in formal training programs in surgery and in medicine, and the hospital's changed quite enormously. I remember when I first came here, people said, well, we'll never get a CAT scanner. They cost a couple of $1 million, and clearly we didn't have that sort of money. Well, not only now do we have a CAT scanner, but we've got an MRI machine as well. We've got a whole range of specialists. We've got 3 physicians. When I started here, we had 1. We've got pretty much the same number of deliveries, but we've got specialist input into all the deliveries here. There's a whole range of things. We do over 4,000 operations here a year. It's become quite a complex hospital in many ways, and that's what I liked about it. It was just the right size. It had the complexity to be really interesting, but it had an optimal size that you knew just about everyone in the organisation, and you could work with them about. There was a community feel, and you could do things that clearly would benefit patients. And the patients were not anonymous, the staff weren't anonymous. So there was a very, very good feel to how the hospital went. And we did some really innovative things. We developed a program called Limited Adverse Occurrence Screening, which I wrote up as part of a doctorate, and we wrote some papers for the Medical Journal of Australia. It was a very innovative quality and safety program, and it was copied by a number of hospitals around Australia. And I can remember the Minister for Health coming up here and just being blown away by the fact that a hospital 300 kilometres from Melbourne had actually developed a program that was being implemented by large hospitals in the capital cities. And so it was you were able to show that really in rural areas you're able to do things that are quite innovative. It don't have to be the poor cousin compared to the larger hospitals. And there's a number of times that we've done that with various projects around the place. So it's been an exciting place to work at times. Probably the major downside has been, and it's not a fault of the hospital, the major downside's been that it's Australian graduates in medicine, nursing, allied health just don't want to come to the country these days. And we've really struggled, as have just about every rural hospital, in being able to recruit doctors, specialists, GPs, physiotherapists, pharmacists. We could go right down the list. And that's been a great pity. Yvonne and I came here. We had an initial plan to stay for 5 years. Obviously we've overstayed the mark there, but we came here. We decided, we continued to stay here. Our kids were born in this hospital. They went to school in Horsham. Unfortunately, they're not coming back because they've got careers in Melbourne, but it was a great place to bring up kids. We lived in Horsham West, and they could walk to school, to the primary school, and they could walk to the secondary college. They could go and play their sport and ride their bikes safely around the town and do everything that they wanted to do. And it was a great atmosphere. Yvonne works in general practice at the hospital's building across the road. As a GP, she's got access. She can knock on the door of the physicians and the surgeons and the obstetricians working in the same building. So if she's got a problem with a patient, she just knocks on the door and talks to the relevant specialists. The ones that come up from Ballarat, she's got all their mobile phone numbers and she rings them up and discusses patients and whatever. She can refer to the emergency department. If she wants to, she can admit patients under her own bed card. She's got access to CT scanners and MRIs and a whole range of pathology services. I just can't work out why young graduates don't want to come into that sort of environment where they're incredibly supported with a whole range of very interesting patients and good support from the hospital. Like Yvonne doesn't get called at 3 o'clock in the morning because people know that they can go to the hospital. There's a doctor that's up and awake. And if they come in and they're admitted, Yvonne will get a call in the morning from the registrar that's been in overnight, and he'll say, look, we admitted so-and-so under a particular specialist, and we know you're the GP. We just wanted to let you know that they were in hospital. What could be better than that?